Hi, I'm Tom McCutcheon. I work for Motivational Services. I've worked for them for 10 years. You and I talked last week about your meeting this Friday. And how did your meeting go? Did you get anything accomplished that you wanted to do?
I told him how I felt. I told him I felt overwhelmed, that there's too much to do and not enough staff.
So you're still feeling overwhelmed. And how did they take that? Did they give you any feedback as to what you could do?
They told me that I'm helping the patients too much. They told me that when a customer comes in and they have a prescription that is not correct or not filled out completely, that I should tell them that they need to go and get this filled out by their doctor. Or if a patient comes in, tells me that there is a fax in our queue that we need to go look for, we look for it and it's not there, that I should just say, it's not here, we'll call you when it comes in.
And are you comfortable doing that?
No.
So,
I try doing that and they come back with, either they'll wait for it and they're sitting there waiting and I keep looking, and then when it does come in, I'll get it off the queue. Then most of the time it's not filled out properly and I have to call the doctors, and people are sitting there, and when they're sitting there we get phone calls, we get more faxes in, and we just can't keep up with the volume that's coming in.
so do you don't have the time to get to the faxes, and it's still the faxes are still coming in, and people are sitting in there in your office waiting for these faxes.
Right.
So, and they told you that you're being too nice by not or by filling out the faxes or helping them with the faxes to get their orders correct.
Right. And they told me not to do that anymore, that I need to put it back onto the client that comes in, because I don't have the time to do this because I have so many faxes, which we do have a lot of faxes, but I just don't feel comfortable telling the client that this is what we got to do and this is what we need to do now. When I was trained, this is what we were trained to do. When you get a fax that comes in, you get an order that comes in, this is what we do. So
Right.
now they're telling me that not to do that. They're telling me to put it back on the patient, to have the patient tell the doctor, we need a diagnosis, we need to know what the reference numbers are, we need to know what the compression strengths are from, whatever. You need to be more specific on what you are asking for and not leave it up to us to determine.
So you're not comfortable with letting it be left up to the client when you can do this more efficiently by contacting the doctors and having them give you the information you need.
Right. They can, I can call the doctors. They can tell me over the phone exactly, and I can discuss it with the doctor. I can discuss it with the doctor or the nurse, and they'll tell me exactly what they're looking for. Okay, I'll fill that prescription, and then I send a verbal order out saying this is what I gave the client. Now you just sign it and send it back to me. Which that works much more efficiently than me calling the doctor, leaving a message saying, what do you want? Leave a diagnosis, blah, blah, blah. And then they call back, and if they can get a hold of me, that's great, or give a hold of a live person without leaving a message like I had to leave a message, then that's great. But if they have to leave a message, we're playing phone tag all along, trying to figure out what this client really needs and what the doctor will agree to. So it's a phone tag type thing, and it'll take us 2 or 3 days to even get to at the actual thing. If we can get a hold of somebody and actually talk to them. But even if, okay, so if I tell the patient, you need to go talk to the doctor, tell them what you need, or tell them tell them that I need a diagnosis, I need all this shit, and they can send it back to me, that's fine. But a lot of times it's much easier to get it over the phone, and then I write it down and put it in a verbal order and fax it back to the.
So, are there some ways you could maybe trim the faxes back? Are there maybe faxes that don't need that priority, that possibly the client could wait a few more days on? Or are the faxes necessary that day?
There are some faxes that we get and we don't know. I mean, a fax comes in, we don't know it until we open it up, actually see what it is. And then we see what it is, and if it's a client that is already established, and that's all we need to know is that they're ordering more supplies, then we can figure, that's pretty easy. But if it's a brand new patient and we have to put the patient in and we don't have the insurance information or any of that stuff, we have to call either the patient themselves if we have if we have a phone number that we can get hold of the patient, or we have to call the physician's office back to get all that information from them. And a lot of times when you call the MD office, you're on hold,
So an established client, you can take a little more time doing the faxes with. You don't have to get them completed that day. New clients, you need to get the faxes completed as soon as possible with a diagnosis.
Right. Well, we try to, and if we don't get it, then the patient is not going to get their supplies as soon as they think that it's going to be. When a fax comes in, a patient or a client or customer thinks that as soon as we get the fax, we should be able to fill it and be, they could walk in the door and walk out with it, but that's not how it happens.
Right.
We keep, we have stuff in the store, but anything with ostomy, urological, incontinence, dressings, we have to order all that stuff, and they don't realize that. There's a lot of things that the patient don't realize. They think, just like if you're going to fill a medication, I think that's what people think, that if I get a prescription to go in and fill a medication, that this medication is there ready for me to pick up half an hour later or however long. But that doesn't happen because there's so many people out there that need all these supplies, and there's so many different supplies that a patient uses for urological supplies, ostomy supplies, and incontinence supplies, and dressings that we cannot keep. We don't have that room to keep all that stuff for all the patients that we serve. We serve not just the people in Augusta, we serve all around Maine.
Right. Well, it sounds to me like you're trying to be the best customer service representative you can be in taking care of these people and making sure they get their orders in, and that they're telling you that you're being too nice, wanting to get it all completed in a certain amount of time, in a day or 2 days. Would it be possible for maybe you to just take the people who have the immediate need first?
Everybody thinks they have an immediate need. I mean, we have phone calls coming in all the time. I mean, and they'll call me up and they'll say, this is what I need and blah, blah, blah. So I'll look at it and there it is, or I take it out. And then I get halfway through this and somebody else is calling me saying the same damn thing. So I don't know who's immediate. How do I know?
To prioritize the people that you're talking with. You obviously know that new clients are going to take longer. You have to work on the faxes.
Right.
Established clients, you can take a little longer with them when you get your faxes in. Do you think it'd be possible to just prioritize for the new clients to get them established first and then work on?
So what you're saying is when I get a new client in, tell them what the procedure is. What the new procedure is if I get a new client, this is what I'm just thinking, because what they're telling me is, if I get a new client, before we even get them established, let them know the ground rules, that it's up to you to get everything that's needed for that script.
Correct. Letting them know they need to get that script filled out, and
Right.
if there's any problems with it, you can let them know.
It's their job to do it.
Right. And then the ones that you already have established, you don't need to finish in that day. You could take another day or two to do it, right?
I could if there was, but a lot of times with the faxes, they've already been in the fax for 2 or 3 days. And then when we get to it, I can't take 2 or 3 days to get through it because it's already been sitting for 2 or 3 days. I don't know. It's hard, and we just need more help. And they're saying that they're hiring new help.
So they at least agreed.
At least I talked to them.
You did talk to them, and you did excellent by talking to them. And they have agreed to hire more help. So I think you need to try and work on prioritizing the new clients and letting them know what is expected of them.
Any new clients? Yeah, I don't have a problem with telling the new clients. But when I was first started there and they told me this is how I need to do my job, blah, 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 this is what I told the clients, and especially a lot of the clients that was already there. So this is a whole new thing when they're saying that I need to tell the clients now that they have to take care of the stuff. Right. So that's new. So I don't have a problem telling the new clients that.
Right.
Because they're new and they're new to this, they're new to our service. But we have clients that are not new to our service and expect that, and because we have been above and beyond, we have been one of the only pharmacy that will deliver and get it to you and bend over backwards for you. And now you're trying to change that.
Well, and maybe if you start with the new clients and set down the ground rules,
right,
it would be a little easier later on to do it with the already established clients.
Yeah, exactly. Right. So, things have changed, insurances have changed, and our way of business is changing. A lot of pharmacies closed because of all this things that are going on, and we need to change our practice, which we've changed our practice. We used to order every day, and now we can't order every day. It's not that we can't, but we're losing money if we order every day.
Right. And that's one of those things that with the new clients and even the old clients,
right,
you could let them know that you're not ordering every day,
right,
not like you were before, and that it may take a couple days to fill their orders.
Right.
So, all right. Would you be willing to come back and talk to me again about this, and we'll see how you're doing next week?
Right. We'll see how it goes all next week.
Okay.
All right.
Thank you.
You're welcome. Thank you.